Okay, I'd like to call the Mason County Board of Health meeting to order. It's July 26th, a little after 3. And I guess, Dave, do you want to do the introductions?
Yeah, sure. Let me get back over that screen. Okay, so we have our chair, Peggy Van Buskirk, myself, Kathy McDowell from the city. We have Darren Moody, and then we've got Dr. Gardner in there coming to us live from Utah. Sharon Trask, Commissioner, County Commissioner, Kevin Schutte, County Commissioner, Mackenzie Smith, who is running the show here for us. Mason Web TV is on there. And then of my staff, I have Ian Tracy from Environmental Health and Melissa Casey. And Gary's on here as well. So
we really have a quorum now.
Yep, we're looking good.
Okay, so can I get a motion to approve the agenda?
I'll move to approve the agenda.
I'll second.
Any discussion? Hearing none. All those in favor?
Aye.
Aye.
Any opposed? Okay, so can I get a motion for approval of the May 24 minutes?
So moved.
Second.
Any discussion? Hearing none. All those in favor?
Aye.
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 Any opposed? Hearing none. We'll move on to approval of the term limits. And Dave, you're going to speak on this?
Yeah, so 1152 in our last House Bill 1152 in our last meeting, we talked about different categories. We've got the categories all lined out. I haven't received any applications for the community member slots yet, so still waiting on those. The one piece I did miss and that we need to talk about is the bill does require term limits. Now, it doesn't require term limits for the electeds that are on the board. The public takes care of that, through the voting process. Yeah, but the other members of the board would be subject to term limits in the legislation. So I was just kind of throw some things out there. If we could do like a 1/3 each year and then a 3-year rotation. So 2 people 1 year, 2 the next, 2 the 3rd year. And then on the tribal members, I don't know. I mean, we've never had tribal members on the board. We have the 2 slots available. But I think those come through the American Indian?
Right.
Right. So that group is going to appoint those. And I think we just let them deal with their own term limits there for those positions. So they're appointing, they're putting people on. We just have the places for them to be. So that's just kind of my idea, throwing it out there for a board discussion and on how you wanted to arrange that. And then I can either bring it back this next time or we could vote on it here and I just write it up formally.
Any thoughts?
Dave, how many unelected people are on the board total?
So we've got 6.
So like I'm elected actually. So I don't know if you count me as unelected or elected.
But no, they have very specific requirements. So elected, according to the bill, are county commissioners and city commissioner, city.
Okay.
Yeah.
So I'm not elected?
You're not considered an elected, no.
All right, I go
this
for
board.
short term limits. What's that term limit? Where are we at? Yeah, I would make a motion that it revolves so that not everybody drops off at the same time. But for now, I'd say 2-year term limits is sufficient, I would think.
I think most counties or most board of health are doing 3.
Why do we want to be like everybody else?
Well, for your
I think-
for your administrator's benefit, that gives me 2 each year that I change out. So I keep my numbers small.
I think that's better to have at least 3.
I'm good with that.
I'm good with that.
So would you like to amend your motion?
I was just giving discussion, but I'll amend the motion and I'll say, I make a motion that we rotate them so that not all of us go out in 3 years, and we can discuss later how that rotation would work. But for now, to say a 3-year term limit on all unelected members of the Board of Health.
Do I hear a second?
I'll second.
Okay, all those in favor?
I
Aye.
I-
I guess I didn't say any discussion, but I think we already discussed it.
Dave, maybe since you're the administrator on it, you can look at what would be easiest for you as far as rotation goes, whether it's alphabetical order for this year or whatever else in the 3 years, but figure out who rotates in 3 and who rotates again, maybe,
Yeah,
so that you don't get them all at once, and then come
Yeah.
to us and let us know.
yeah, I think I'll see how I spread them so that we don't have any one category disappearing any year either, so.
Okay. So any more on that, Dave?
Nope, that's pretty much it. That gives me some direction.
Okay, Carrie, I guess you're up.
Hello, everybody. Thank you for taking the time to be here today. I'm going to start talking about COVID because it seems like we are still talking about COVID. We have seen with this latest variant, which is BA.5, a small increase in the number of hospitalizations and deaths with it. So while we initially thought it was less virulent or less aggressive, maybe is a better word, we are seeing that uptick in people being infected and hospitalized. We do have good therapeutics to treat COVID-19, and they appear to still be effective against the BA.5 variant. So I want to encourage people to be educated about what's out there and know who qualifies for treatment when you think you're sick, and go see your doctor just in case they don't suggest it. And if you go to the CDC website, you can see who qualifies for treatment and what the different therapeutic options are. The variant that is circulating now is BA.5, and when it first reached Washington at the beginning of June, it took only 6 weeks to become nearly 3/4 of all cases, and now it is 3/4 of all cases. It's just to go to show how the variants act differently. So BA.5 tends to be extremely transmissible, and what we're seeing is a much shorter time from when you're exposed to when you start exhibiting symptoms. And then generally people test negative on the first or second day if you're doing a home test. But if you go to the hospital, you could have a positive PCR test. The therapeutics that are available are able to be used within the first 5 days, or in the case of some of them, 7 days.
What is,
the
I'm sorry.
Yeah, go ahead.
You said it's much quicker, I guess you could say, testing time. So if I'm taking an in-home test, let's say, which probably 80% of the people out there are doing now,
Right.
if you test within the first couple, it may not be accurate to test 3 or 4 days in. Is that what you're saying?
Absolutely, yes. The latest variant is BA.2.75, and it was identified in early June in India. It has not yet reached our shores, but it is expected to reach here. Why do we keep talking about the variants? It's just because they do behave differently. If you remember the initial variants Alpha and Delta, people were really sick and a lot of people died. And pathogens tend to mutate in the direction of being less virulent, in other words, less deadly, but that's not always the case. And so that's why we're keeping an eye on these variants, is to identify their different behaviors so we can better inform people how to be treated for it, and if there would be coming a time where we would all be really nervous about congregating again. Another interesting fact that Washington State Department of Health revealed to us is that they estimate that the case numbers we have are only 12% of what's out there. So the estimate that you just gave, which was that 80% of people are doing at-home tests, is accurate. They're seeing the same thing. They think that 78% of cases are not being reported because people are testing positive at home and not reporting them. Dave will be talking about the program that Washington has of how to easily report your positive home test so that we'll have better data. I'm going to move on from COVID to other infectious diseases, but I wanted to pause here in case there were other COVID-related questions. Okay. Influenza is having a really late year, so we're still seeing positive influenza cases and deaths. Nothing to do about that. It's just interesting because we don't usually see influenza this late into the summer. I also want to talk about monkeypox. The World Health Organization declared it a disease of international interest this past week. And that is because cases are spreading very rapidly. In Washington State, as of July 22nd, we've had 83 cases. A small portion were related to travel, a small portion were not related to travel. The majority were considered unknown etiology. The cases that we're seeing are doubling rapidly. And so far, the population that they are in is generally men who have sex with men. And this is an unusual transmission for monkeypox. It's a disease that is endemic in Africa. In 10 countries in Africa, it's just part of the community. It's been there a long time. So we're not really sure why it has become so much more prevalent here, but it does seem mainly to be in this special population of individuals that are high risk. It is considered able to be transmitted in a respiratory fashion. So theoretically, wearing a mask would make a difference with monkeypox transmission. However, we're not really seeing cases that we are sure that were transmitted by respiratory. We were really seeing it in people who have close physical contact. This is as those of you who are old enough to remember, as I am, how the AIDS virus started. Is it started in this population and then became much more prevalent. So I just wanted to say, while we talk about this being in that special population currently of men who have sex with men, that this is of concern to all people, and kind of a reminder, if somebody has a rash, if physicians are seeing a rash, to please contact us or the state for how to test it. It's tested really just in a standard viral transport medium, but there will be special handling and where you send it. We're getting ramped up ability to test for it in the commercial labs, and that is the preferred route for people who have insurance, but the public health lab will do tests for people who do not have insurance. Last thing about monkeypox is that there is a vaccine that the federal government has released. They have not released enough doses for the at-risk population in Washington State. So since the majority of our cases are in King County, the majority of the vaccines are going to be in King County. And the other counties will have smaller portions. They have much smaller caseloads. We do not have any reports of monkeypox in Mason County so far. Monkeypox also has a treatment. There is an antiviral medication that can be used for severe cases of monkeypox. Any questions on monkeypox before I go on to other viral diseases? Okay. There is an unknown hepatitis or an acute hepatitis of unknown origin that is worrying people nationwide because it's in pediatrics. So the special group is under the age of 10. And so far, Washington State has ramped up their response in order to look at the cases of suspected acute hepatitis of unknown origin. So far, we think we have very few, maybe just 1 to 2, but there is a special group that is assigned to looking at that. So again, just information for parents and physicians to know that this is out there and to please refer to us or to the state if cases are suspected. The UK has had the greatest number of cases so far, and it really does not appear to be something that is transmissible or spreading at this time. But like the title says, we really don't know what the origin of it is. And the last viral disease that I wanted to speak about is hepatitis C. Washington State has a program to try to make Washington State hepatitis C free by 2030. And part of this program is that they are paying for anybody who needs to be taking hepatitis C treatment so that it's accessible to anybody on Medicaid or commercial insurance. Hepatitis C treatment used to be very expensive and it used to be considered dangerous or difficult. The current treatment we have now is only of 2 months origin, 2 months duration. It's just pills twice a day, and it is not associated with a lot of the side effects that we saw with previous treatments for Hep C. Along those lines, I reached out to Mason General to try to improve the availability of Hep C treatment in Mason County. Currently, people can go out of county and receive treatment in Olympia, but we're trying to bring it home. And so we're working with Mason County to make that more available. Any questions on any infectious diseases before I go on to mental health substance abuse? All right. So nationwide, we have seen the CDC says that all of the indicators of emotional distress are lower nationwide as far as visits to the ED for suicidal ideation, suicidal attempts, psychological distress. And that's really good news. And it's actually also surprising because there has been so much upset in the world. But what we are seeing is an increase in overdose deaths in our substance use population. This is attributed to the to the current fentanyl that is being circulated, which is in a pill form. And so it's very easy for people to either smoke it or inject it, and because it's a very small quantity that has very high potency. So we have already, I think, at this point, exceeded the number of overdose deaths that we had total last year. And of course, we're just a little over halfway through this year. So
Are you talking Washington State or Mason County, Doctor?
Both.
Okay. Because Mason County, we really reduced it quite a bit in the last several years. Correct?
Yes. It's this currently circulating fentanyl pills that are much more potent. And then of note, Dave and I review all of the death certificates every month. And our population that is of greatest risk for suicide in Mason County is our males in the 50 to 65-year-old age category. And their suicides are generally by firearms. I thought that deserved to be brought out to the board. That's my last update on mental health and opioids. Any questions on that? And I have one last final comment.
As long as your next comment is a little bit positive with something cheery in it. I don't care if it's rainbows and unicorns, just something to throw out there, please.
It's almost like I asked you to ask that question. Thank you so much. I would like to congratulate our community services director who came into this program looking to increase the funding that we could bring into Mason County for our foundational public health services. He has seen the fruition of a decade of work in the allocation of $1.26 million from a collaboration between the Department of Health and the State Board of Health. The funding has been allocated by the state, and it's for the next 1 year. I just want to contrast this with the amounts that we got 2 years ago. It was, or 2 or 3 years ago, it was 200,000. Last year it was 740,000. This year, 1.26 million. So I want to congratulate him on bringing those dollars in to help us improve our health in Mason County. Thank you, everyone. I will turn the floor back over to our chair.
Okay, sounds good. Okay, so Dave, you're up again.
Okay, so, well, I was going to talk about finance, and Dr. Gardner kind of jumped onto that. So we do have this new FPHS money, and we just got the contracts yesterday. So commissioners, you'll be seeing this and briefing this next week because it does expand what we're going to do. So it's not what was approved for me to just go ahead and approve that we went through this last spring. So a big piece of that is going to be course of life work. So think of all those things that we know kill us: obesity, diabetes, heart, stroke, that kind of stuff. We will have money of that money. $360,000 is dedicated to just that piece of work. So this time the money has come through with a few more brackets around things, which it's not a problem. I just finished today the FPHS report for last year on how we spent the money and where we increased capability and where we increased expertise. It was interesting as I went through it. In some cases, we've increased capacity, but we lost expertise because we had Alex and Lydia who have, Lydia's retiring. In fact, her retirement party's tomorrow. No, Thursday. Yeah, get it right, Dave. So in some ways, we went backwards a little bit on the expertise, but we've got a capacity that's continuing to build. So that looked good. FPHS, like I said, came with more brackets. So they're breaking out assessment. They're breaking out a number of different things. They'll actually make it easier for us to plan as we go through and say, all right, in this category, how much do we want to spend? In this category, how much do we want to spend? And then we've talked with the commissioners. And if we grow, where do we go? So putting people in seats will be probably the biggest thing we'll be looking at. So they did loosen up some of the restrictions on this contract. It appears that we can pay for rental if we need to for building rental, but nothing for capital projects, which would have been nice. We're going to be asking for some of that this year as well. So that's kind of on the FPHS end of things. We did have a substantial spend at the end of June. We bought another 10,000 test kits for our assessment piece of work. And then I just got another 2,000 kits in from the state. So we've had quite a demand lately for home test kits. Like we were talking earlier, 80% people are testing at home. So we are going to support that effort. We've got a lot of test kits here. They're going to be going out this next week in a similar way to we did this last spring. So to community organizations that can get them to large numbers of people, like the Hub in Belfair and fire halls, places that people go. So we'll have those tests going out this next week.
Hey, Dave, I don't know if it came from you, but the senior center here was very excited that they were handing out kits at lunchtime over there. So wherever those came from, that was a good thing.
Yep, that was us. So we sent some to the senior center and we sent a bunch over to the city. So the city got, I think, 4 cases. They're going pretty quickly right now. So people are taking up. They took up the challenge to take care of themselves, which is what we put out through us and through DOH this last spring. And I think that says something about our population, because we really are seeing a lot of sick people, and we're having people who are calling in that are testing positive at home. They know they've got COVID. They're staying home, doing the right thing. So workforce is being impacted, but we are supporting with the test kits. I wanted to go over a vaccine update. So we have Sanofi has come out with the Novavax, and that came out for emergency use authorization this week, actually last week. So Friday night, I put in an order for 300 doses, which is our max that we could get for Mason County at this point. It's going to, instead of coming to public health, so public health is supposed to run the distribution of this vaccine for the near term. So we're getting 300 doses in. I sent those 300 doses to Mason General. We're going to send some out of Kitsap to Belfair, especially around PCHS. They haven't decided yet whether they're going to run with another vaccine. The nice thing about this vaccine is it's different than the others in that this is not an mRNA vaccine. This is more, think of the old style vaccine, measles, smallpox, that sort of a vaccine. It's made in a little more complicated way, but I think it's a little more durable way, where the RNA is combined with DNA. The DNA is put into a host cell. The host cell grows the spike proteins. The spike proteins are harvested and used in the injectable. And then they use a plant extract to irritate the immune system, and that increases the uptake of the spike protein. So I think this is kind of layman's terms. Dr. Gardner's laughing because we've talked about this. I think this is going to be a more durable vaccine, and it doesn't have the super cold requirements to maintain this vaccine. So I think it's going to be more usable. And I think it's a vaccine that people have been waiting to come out, something that they trust how this is done, because it's done in the way that vaccines have been done for decades. So we hope to see some uptick on those people who were definitely vaccine hesitant. We would like to see that the emergency use authorize this as a booster. So that's not authorized yet, but we see that coming pretty soon, where they can get a boost. This is still a 2-dose vaccine, 3 weeks apart. And I took a training yesterday on this particular vaccine, how it's made, and the efficacy and side effects and effectiveness over time. And what they found on their test is that the mRNAs tend to jump up very high, very fast. And then as time goes by, they start dropping off. What we're seeing with this particular one is it doesn't jump up for about 2 or 3 weeks, then it comes up, and then it stays flat. Efficacy stays flat, which is it's nice to see. It's not dropping down in the same kind of time period. It's still new, but it's being used all over the world. So we expect to have some good results with Novavax. Moving on, and if you have any questions about vaccines, where we're at, lots of vaccine out there. Okay. Our birth and death certificates, those of you who have been in our lobby know that it doesn't take very many people to plug up our lobby. And we've got room for like 3 people out there. And sometimes we have as many as 7 or 8. We're looking at a company that the sheriff's office is using to do all of their concealed carry permits. It's called Permitium, and will allow us to do those birth and death certificates. People can do them at home, online, or on their phones. Request the certificates. The certificates are then go through this company called Permitium. They send us a workflow in the morning. The next day, we print the certificates, and some will mail, some people will pick up in person. It costs us nothing. What the company does is they add $4 to the cost of the first permit, and that's how they cover their cost of providing the service. One of the nice things is this supports 109 different languages. So we don't have the problem in the lobby of trying to get, except the Guatemalan population. We're still going to have some barriers there possibly. But Spanish, Russian, Chinese, and any number of languages are supported. And if people come into the lobby, we have a QR code. They can just pull up their cell phone, zap the QR code, do it on their cell phone right there in the lobby without having to do paper. So we talked with Grant County, a couple other counties are looking at the same process, and none of us can find any drawbacks. It's a win-win from what we can see. So we're going to be looking at doing that pretty shortly.
That sounds like a great thing. I'm still stuck on the fact that we're automating concealed carry permits.
Yeah.
In case you get a hand cramp.
Yeah, I don't know.
I can say that I'm not an elected official today, remember?
That's right. That's right. You're in the retired category. So yeah, just, if we can automate this, we're looking to do some more automation through the environmental health program as well. So there are any number of things coming out that will be advancing that, cut out the paperwork. And that's just the first thing. We have a cooling center set up at Public Works, not at PUD1. I made the mistake yesterday during briefing of saying PUD1, and the director of PUD1 was texting me before I even quit speaking to say not us. So it's not PUD1, it's Public Works. We have a couple people out there today and tomorrow running a cooling center. We did send out some information on cooling centers that are available around. The city's got a cooling center up. A number of the senior citizen groups have cooling centers, so we're supporting that effort right now. We had a couple of people just jump on that task yesterday and just ran with it. So very pleased with my crew doing that. Met last week with Peninsula Community Health Systems up in Bremerton, looking at doing some innovative things around bringing a med van down to the homeless shelter to take care of some of our homeless folks right there at the shelter. I come down a couple times a month to do some of that work. And other than that, it's just finance and HR and all that happy stuff. So any questions? Yeah, Commissioner.
Yeah, so glad to hear you reached out to Peninsula on that. Also recommend that you talk to Thurston Mason, BHASO. We have state funding through Healthcare Authority to do the homeless outreach stabilization program, which is bringing in peer mental health clinicians as well as RN and ARNP to do the same work. And so want to make sure that we're dividing the labor appropriately.
Okay.
It's a partnership with Providence as
Okay.
well.
You know, something that this came up today, we had a meeting today with the Homeless Coalition, that people don't realize. Everybody's crying for mental health counselors. What a lot of people don't realize is that in order to be a mental health counselor, you have to have a master's degree in social work. You have a master's degree in counseling, and it doesn't count if you don't have a master's degree in social work. So we're talking about going to the legislature to see if we can break that off and create the ability to have more people eligible to do counseling and to be those behavioral health intervention folks. So that will be coming this next legislative session. We're going to be pushing for that.
Sounds good. Any other questions for Dave? Okay, I guess we're on to environmental health report. Ian?
Good afternoon, everyone. How are you today? It's definitely hot. I think you've all seen my environmental health report. One thing that I did not get to include on it before I went on vacation last week is we had the state's first rabies positive bat on July 12th. And that was the first rabies positive bat that Mason County has seen since 2016. So it was a fairly significant event for us. And we used the event as an opportunity to do some public education around that with a press release. So some of you may have seen that. But the general story is the bat was found in the couple's bedroom. Their cat woke them up at around 3 a.m. to say, "Look at what I caught." So it was not a pleasant surprise for them. But the cat is being not quarantined, but observed for 45 days as per the state WAC. Did anyone have any questions about the report that I submitted to the board? Yep. I don't think there's been anything else new happening other than that. That's all I got for you.
Okay. Look good to me. So, okay, so hearing no questions for Ian, I guess we'll be on to Melissa for community health report.
Good afternoon, everyone. So you may have noticed in this month's packet that we've launched a new format for our community health report. I'm hoping that you like it. It's something that we're intending to adopt, a similar one-page format as an impact report that staff can use for outreach when they go to resource fairs, when they have meetings with key stakeholders, and something that we'd like to periodically share on our website as well as social media. We're recognizing that people just don't have the time to read lengthy material. I know that was part of my motivation. So an impact report is really, it really helps to communicate the value of our programs in a more attractive and effective way than a 10-page report. So if the Board of Health prefers the long report, we can certainly return to that. I just need to know. But I just want to share some of the key outcomes that we had over the last 2 months in community health. So instead of sharing just a 2-month report for our housing data, we had an end of year report. While it's important to know that, homelessness is definitely something that we learned this morning is a growing issue in our community, but it's important to note that a large number of families and individuals have still been touched by our homeless response system. So some of the key data is nearly 900 evictions were prevented in our county over the last 12 months. 600 individuals stayed in our emergency shelters. And one of the other key items is that the profile of homelessness is a really big comprehensive report on all of the data. We have the PIC count, we have all of the state data on homelessness in our community. That's been published, and that is now available on the county website, the community health section under housing and homelessness. So I definitely encourage you to review that if you can. There's also a link on the impact report. Behavioral health and recovery support transportation program. It's been very busy. We've had 114 transports within the county to various types of substance use and mental health related appointments. They could be medical appointments, other recovery supports, and 16 were out of county. So again, mental health is a very, very huge priority in our community. While there's a lot of work that still needs to be done, there have been small strides through the programs that we have here at Public Health. I also had the opportunity to attend a positive community norms conference with our substance abuse prevention coordinator last month. A lot of the data, and we also kind of caught some of this a little bit earlier in our meeting, a lot of the data that we share in our assessments and in our reports, they can feel very negative. It could feel like we are very much just highlighting where the gaps and the needs are. So one of the things that I really loved about the positive community norms is that there's a lot of data that we can celebrate as well. A lot of the things that we're doing well in our programs and a lot of the things that have worked for our community. So we're really excited to spend the summer developing a campaign utilizing our Healthy Youth Survey data to not only highlight ACEs and what kinds of risky behaviors our youth are engaging in, but also to promote PCEs, which is positive childhood experiences, and how those can lead to positive outcomes in young people in terms of substance use. So we're working just on kind of looking at that data and seeing how we might be able to put out just a few tidbits on social media around the community. Our substance use prevention coordinator partners with our high schools. So we're really kind of utilizing the youth in those leadership groups to shift some of the messaging. So again, I think this kind of messaging is something that can be utilized in all of our programs. For example, just taking the subject of overdoses, instead of saying we've had X number of overdoses in our community in the last month, we can focus on things like 12 overdoses were successfully reversed with naloxone in the last month. So again, you're really demonstrating the success and the positive things, the effectiveness of our work. So again, I just wanted to share a few of the highlights from our report. I encourage you to take a look at it. Going forward, this is a model and a format that I'd like to shift our reports to for the Board of Health. But if you feel that you would prefer the longer version, we can certainly do that. Just let me know. Finally, on Friday, this past Friday, the 22nd, via the Mason County listserv, I sent out a link to Mason Health's 2023 to 25 Community Health Needs Assessment Survey. This is different from the community health assessment that we conducted for 2021. This is a federal requirement of public hospital districts. So your feedback is critical in, again, identifying what the additional needs and the priorities are in our community. So if you need that link, we can certainly put that in the minutes, I think. If not, it is also available on our Facebook page. And that's all I have.
Melissa, a couple quick comments. Nice to meet you, by the way, but you talked so fast that I couldn't even get my comments in.
I'm sorry.
That's okay. It was awesome. It was all good stuff.
Okay.
Don't ever let somebody tell you that the little victories aren't as important as it is. In a small community like this, it's half a dozen differences makes a huge difference. And second of all, speaking of messaging, I know from somebody who's been around the community listening to it for the last 7 or 8 years, when you say X amount of evictions were avoided, maybe look at how you say that, because there is a portion of this population out there that are landlords or otherwise, and are going to say avoided, like they didn't pay rent.
Mm-hmm.
So you were talking about messaging, and that struck me as kind of one of those things of, I don't know, I'm not giving you an answer. I don't have the way to tweak it, but I'm just saying, when you say, you know, these evictions were avoided, maybe some way to explain how they were avoided, how we helped people with a leg up instead of a handout kind of thing.
Sure. No, I appreciate that.
But other than that, awesome report.
Thank you.
Just
Okay,
slow down.
If I could just add real quick too, I think that that's a great idea about, you know, maybe explaining how they were paid, you know, how, you know, they're maybe rental assistance instead of evictions. We were able to help them pay their rent by using, you know.
Yeah, and like I'm trying to figure out a way to say it in my mind, but I just don't want people to think that somebody's getting the bad end of the stick on this. I want to make sure that people know it's a good program, and let me explain what it does for everybody involved in it, not just this segment.
It's all about messaging, right?
Pretty much. And I like your format, by the way. It's very colorful.
I'll be honest with you, it was when I was reading the original version that was 10 pages long that I decided, this doesn't really work for me either. I think we need to shorten this. But certainly I think maybe, even quarterly, if you prefer a more comprehensive report, we can certainly do that.
Okay. What does others think about that?
I like the format. I think it's concise and it gives us, and I think the only thing I would say is you talked about quarterly, instead of giving us a long report quarterly, maybe just highlighting things that we know along the way and go, okay, can you expand on these particular items rather than expand on everything?
Sounds good.
Okay, thank you.
Any other business or board discussion?
Yeah, Madam Chair, I just had one quick item to talk about with the board, just more of an informational thing than anything, I guess. So along the lines of some of the issues around the homeless population and some of those challenges, one of the other things that I've been hearing about quite a bit, and I'm sure most of you have as well, has just been the lack of crisis stabilization beds, involuntary or voluntary treatment beds, which are very different than involuntary treatment beds. And so to that end, with the BHO, I'm going to be traveling to Spokane here in a couple of weeks to look at a crisis stabilization facility there. And so we're actively looking for partners to operate it. There's a lot of capital money that's available from the state here over the next couple of months through the Department of Commerce. And so just a heads up to the group that we're actively looking for partners that would be able to run and operate that facility. And Northwest Resources has stepped up and started to engage in that conversation with us. And so I really appreciate their leadership on that. But hopefully we can take advantage of some of the funding that the state has made available. Some tweaks need to be made on how the state and the managed care organizations fund the operation side. And that's something that we can work on concurrently as we try to develop a facility here to alleviate some of the pressures that folks at Community Lifeline and other places are seeing with folks in the population that have those co-occurring issues that are so prominent right now.
Yeah, on that note, Kevin, we've had lengthy discussions at the hospital, as I'm sure you're aware, about these situations, voluntary and involuntary. And we've started talking at the 10,000 foot level about what would be the ideal and what kind of partnership the hospital could provide. So there's a couple people maybe as you move forward in it, and that's one is Eric, obviously, and two is Mel Strong, who's been meeting with the law enforcement, trying to get a liaison with the sheriff's office and police departments, better serve the people that are getting, for lack of a better term, stuck in the ER beds. So I would encourage you as you move forward that if you want me to be involved, that's great. But from the people that are doing the work, Eric and Mel are really trying to put together how can we better serve the community and the mental health needs besides sticking them in an ER bed.
Yeah, so I think that's really worthwhile. You and I and a similar group have been meeting, earlier this year and late last year on that issue. So I think that's something that we should start back up again and just kind of continue to lean in on it, take advantage of some of the funding opportunities that are out there, and just kind of continue to work it.
Yeah, because I think both private and public funding, through the hospital, I can tell you the hospital's not averse to freeing up some money or whatever needs to be done to help this project along. So I know Eric's going to slap me and the new CFO is going to come in and go, okay, you're offering money we don't have, but let's get to the bottom of it before we worry about that.
Well, Darren, it's out there now. No take backs. So let's find a time to chat.
Okay. Any other business? And I don't think we have any public. So can I have a motion to adjourn?
So move.
Second? All those in favor?
Aye.
Aye.
Okay. Hearing no opposition, we'll adjourn. Thank you, everyone.
Thanks, everyone.
Thank you.
Thank you.